Hello, Sarah. How are you?
I'm fine, doctor.
I'm Ankur, one of the doctors here. So how can I help you today?
Doctor, I wanted to learn about the hip examination.
Yeah, no problem. We will discuss about hip examination. But before we start, do you have any idea about hip examination?
Well, I just know you have to like maybe look, feel, and move. Yeah, maybe that's about it, doctor.
Yeah, perfect. Yes, any joint examination we do, we have to follow this. Look, feel, move. And after that, if you have any special test, we can do that. Right. So let's talk to a patient and I'll teach you this hip examination.
Thank you, doctor.
Right. Hello.
Hello,
Hi, I'm Ankur, one of the doctors. And may I confirm your name?
I'm John.
Hello, John. Nice to meet you.
Nice to meet you.
Okay, so I was told that you have got some problem with your hip joint.
Yes.
Alright, so the thing is, I have got my colleague as well, Sarah, and I'll be the one who will be doing the examination and she'll just observe.
Okay.
Yeah, is that alright?
No problem.
And for the purpose of examination, I want you to undress below your waist. I have sharpened to ensure your privacy.
Okay.
May I proceed?
Sure, doctor.
Alright, so first of all, what I want you to stand. If you are comfortable in standing, is it? Yeah? Can you stand, please? Perfect. I'll just come to this side. And if you can stand, join your both the legs and palm facing towards you. Perfect. So Sarah, what we have to see the alignment of the joints. Like if there is any like discrepancy in the length. So you can see like shoulder joint, ASIS, anterior superior iliac spine, knee and ankle. They're in the same plane. Right. And in this, as you know that we are doing the hip examination, so we have to do the inspection of the hip as well. So what we're looking for if there is any like any redness, any swelling, any scar mark of any surgery. I mean, like when patient is standing, we can see like if there is any pelvic tilt as well. Even you can notice if there is any wasting of the muscle as well. Right. Then we have to do the inspection from the back as well. Right. So John, if you don't mind, can we go to your back for the examination?
Sure.
All right. So come, Sarah. Okay, so what we're looking for again, looking for no redness, no swelling, and also we're looking for normal gluteal muscle mass as well, so no problem at all. Right. After that, what we have to do, we have to check the gait of the patient as well. We'll tell the patient to move. John, if you don't mind, can you take a few steps for me? Perfect. Please come back and have a seat here. Thank you so much. So Sarah, what we're checking the gait of the patient. Like if the patient when he's walking is having the normal gait, or if the patient is having like maybe triangular gait, or if the patient is having an antalgic gait. So that is what we have to see. Alright. Okay, John, if you don't mind, can you please lie down? Come on, Sarah, come here, please. Alright. So now, Sarah, we will be starting with feel. Right, so what we have got temperature and we have got tenderness. So what we do, like let's do the temperature first. Okay, John, so I'm going to touch your hip joint. Is that alright?
Yes, sir.
So you can just warm up your hand also. So we just compare one hip with the other one. Also, you can compare this one hip with the thighs as well to check if there is any local rise of temperature. After that, we have to do the tenderness. So what we do first, you can just feel for anterior superior iliac spine. So just come here and feel for the prominent part. This is your anterior superior iliac spine. So one by one, check if there is any tenderness. As we are going up, we are feeling for this iliac crest. We are going upward and backward. See if there is any tenderness or not. Right. And down there, I mean on the side, what we can check for, greater trochanter as well. Just see if there is any tenderness. You know, if the patient is having tenderness when we are palpating this greater trochanter, it might be like trochanteric bursitis as well. Right. So after doing this palpation, what we have to check the limb length. Yeah. So I'll tell you about this limb length. We have got this measuring tape. So we have got two kinds of limb length. One is true, one is apparent length. So what we have here anterior superior iliac spine. So feel for it and put it here, and we have to check it till medial malleolus, right? So this is the medial malleolus of the patient. So this is what we have to check. This is our true length. Yeah, true length. So let's check on the other side as well. Feel for the anterior superior iliac spine, and this is, so both legs it's same, right? And now we have to check for apparent length as well. So apparent length will be from umbilicus till medial malleolus. Also, you can take it from Zeki sternum till medial malleolus as well. So let's take from the umbilicus. We start from the umbilicus and see. So that is 41 here, and check it here as well. So it is the same in both the sides, meaning there's no true or apparent length discrepancy in the patient. Right, so that was our field. Now we have to do the movement as well. So hip joint can do lots of movements, right? It has got flexion, extension, abduction, adduction, and it has got internal, external rotation as well. So let's see. Okay, John, could you please bend your right leg and bring your knee as much as close to your chest? Perfect, you can relax it. Right, and could you please touch my hand with your right leg? Right, could you please cross over left leg? Right, you can relax now. Could you please join both the toes and heels apart? Right, could you please join both the heels and toes apart? Perfect, so this is how we do the movements in the hip. You can relax now, right? Okay, Sarah, now we'll be doing a special test. We'll be doing first the Thomas test. This is done for checking fixed flexion deformity, right? So what we have to do, we have to put our hand in this space. This is lumbar lordosis, so we have to put our hand here. John, I'm going to put my hand just beneath your back, yeah? Perfect. This space is there, and what we have to do, we have to obliterate this space. We have to tell the patient to bend one of the leg. So what happened when he's bending the leg, and when this lumbar lordosis will be obliterated, the back will be touching my hand. At that time, you have to see if there is any flexion on the other leg or not. Right, this is what we are checking for fixed flexion deformity. Right, so John, could you please bend your left leg? Slowly, slowly. Yes, right. So at this time, what's happening, the back is touching my hand. And if you can see, like, there is no flexion in the other leg, so that is normal. But if there is inflection, so it is showing us fixed flexion deformity. Right, you can relax now. Thank you so much. So now we'll be doing another test, which is a Trendelenburg test, and that is what we are doing for checking abductor muscles, if the abductor muscles are weak or not. Right, John, if you don't mind, if you can stand. Right, if you can just come to this side, and Sarah, if you can just come to this side. So what we have to do in this test, we have to tell the patient to stand on one of the leg, right? We'll be holding the pelvis of the patient to see where the pelvis is tilting. If the patient, for example, is standing on the, say on the maybe left leg. So what happened, the right side should go a bit up. I'll show you if it is normal. Okay, John, if you don't mind, can I just hold your pelvis? All right. So I want you to stand on your left leg. So normally, Sarah, if you can see, the right side is going a bit up, right? So that is normal. But if it is abnormal and if there is contralateral deformity in the abductor muscles, it might tilt to the same side, right? So that is what you have to check in the Trendelenburg. You can relax, John. Thank you so much. And to complete the examination, always what we have to do, we have to examine one joint below and one joint above. And we have to do full neurological examination as well. Right. Thank you so much, John. Thank you so much.